Welcome back to another PT Pearl on the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Dom.
And today we are talking about bunions. So that little thing where your toe sometimes comes on the inside and you get a good bump on the foot. You know, what does it mean? Why does it happen? And what can you start to do about it? Let's talk about it.
Looking at the research and looking at how often it happens, a lot of people deal with this. And there's so many solutions or potential solutions that get thrown out at us just out in the open world, whether we're seeing somebody or whether we see something online as to how we can fix this thing. So why don't we dive in first to what a bunion is, and then we can cut through some of that.
We know that 2% of children can have we see that they have bunions. So yes, you structurally can be born with having this look of bunions, which is just where the toe, your big toe, starts to come inward towards your other toes. And what you get is, I don't know how medical I want to go here.
So the big toe is called the hallux, right? And that's like the bone there. So a lot of times bunions will be called hallux valgus.
Exactly.
And that just means big toe going in, right?
Yes. What it does is it forms kind of right at the ball of your foot. You start to notice that we do have bursa sacs, or like fluid sacs within our body. And what happens as your toe starts to go inward, those ligaments can kind of start to rub right on those bursa sacs, right along the ball of the foot. And so you can get some pain, irritation, and almost like growth start to happen right at that foot. But we also have to look at not only the big toe, but what the big toe is connected to, what are called our metatarsals. And that's where we get shifting of those bones where the big toe connects into as well. And then we can get, your metatarsal from your big toe coming out while the big toe is coming in. And so that's where you kind of get that V shape right at that bunion.
And I think where we've kind of approached this, in the past has been, it's a big toe thing. Right? Yeah. Oh, it's just the big toe that we're looking at. And how do we get that big toe to come back out? But again, that's where in this world of medicine, we like to hone in on one thing and fix it rather than looking at all the components that could be impacting that big toe. And we looked at this one study that kind of talked through how they are reapproaching how they look at bunions based on the leg and the foot, because there are so many different planes those things work in. Like if our leg is rotated inward, or our tibia, our lower leg, is rotated inward, that's going to affect what happens at the foot, which then is going to affect what our big toes do. Our foot also rotates in this plane and also through the ankle.
What plane?
Yeah, true. You guys aren't watching. So the foot also rotates. If you look at the midfoot, we have these tarsal bones, right? They're kind of like the bones in our wrist, but they rotate. Say if your foot's kind of flat on the ground and you try and roll to the outside of the foot and roll to the inside of the foot. That's kind of pronation and supination, which we've talked about a little bit before.
So that rotation around that
right?
foot.
So if we're not looking at how the midfoot is rotating, then we might be neglecting how that impacts the toe down the chain.
Exactly.
Right? And then even to the big metatarsal, the first metatarsal that Jen was talking about, that thing, it can go out, like she was saying, or it can go just inward towards your other foot. I guess out was a bad word, but inward towards your other foot to contribute to that bump. But also when it does that, it rotates a little bit because our joints have coupled movement. So when it goes out, the way that the joint is structured causes it to rotate a little bit too, which is something we've really been neglecting when we do even higher level medical things to correct or fix these bunions. So again, it sounds a little bit confusing, but this study, I really appreciated how they're like, hey, we need to break this down all the way below the knee to even define what's happening with the individual person.
Ultimately, the research and everything that we looked at, we don't have like one set point of what is the cause. Like they cannot determine this is the cause of why you have a bunion. So that's off the table. So we get to look at every person individually. We did look at prevalence though, and how often that this happens. And again, I said 2% of children, it looks like they have it. So you could be born with it. 20, but that
was 9 to 10.
It was 9 to 10.
9 to
so
10 years old.
I will say, were they born with it?
Yeah. And what happened in those first 9 to 10 years that might cause the foot to want to develop in that way?
Exactly. So, there's a lot of we don't know, right? But we do know 18 to 65, the percent of people who have bunions is 23%. So first of all, I want you to hear this and not feel alone.
Yeah.
You're not the only person who feels like, oh, I don't have feet like they show in the magazines or the movies or what it should look like. Like, you're not alone, and this is a common occurrence. Especially after 65, that rate goes up to 36%.
Yeah.
And I think it was it's prevalent 30% in women, and that's a big number.
Totally. And along with that comes some different like risk factors, or just, women might have it slightly more than men. If you're somebody or it's found that in people with bunions, they will generally wear high-heeled or closed-toed shoes more often. So there are some of these things that it's like retroactively, or we can look back at somebody who has bunions and has symptoms, and they'll do these things more often. But that's not saying that somebody who does these things is going to develop bunions. So again, we don't know the exact etiology. We look into a little bit of the research, and again, kind of through the whole thing, it's, we don't exactly know, because there are some times that it'll say, oh, orthoses showed, more of a difference than no treatment at all. And then the very next study said orthoses did not show much of a difference than no treatment at all.
Yeah.
And then same with surgeries. One study said a surgery, what was the kind of surgery?
The chevron.
The chevron surgery that they would do might have more benefit than doing orthoses or no treatment at all.
Yeah.
So it's like, okay. And again, just looking through these studies, there's very little that compares these higher medical treatments to rehab or PT.
Yeah.
But even within that, we're kind of talking, if you just look at a study that says, okay, this surgery is better than just seeing PT, that at face value tells you nothing, because it tells you nothing that the PT did. If you look into the study, it might be like, oh, they just did joint mobilizations 3 times a week for 6 weeks. Well, yeah, I can tell you why they didn't have as much of a difference or something. So again, cutting into the details and seeing the specificity or specific things that the PT or they're doing in rehab is very, very important.
Hopefully you are working with someone who's not only working on you manually, because that is a passive treatment. Anything that someone does to you is passive. So whether they're using your joint and they're doing some mobilizations, or whether they're doing mobilizations even at your foot, or doing ultrasound or massage to the bottom of your foot, or stretching your toe, whatever it is, they are doing it to you. So these are passive type treatments. Not bad, but if we want to get you functioning in the real world, we have to add a functional component to that, an active component to that. So we are here to hopefully help promote and push that. If you're not getting at-home exercises, exercises in the clinic of what you need to be doing for your foot and ultimately your whole body, it's okay to say, this physical therapist isn't working for me and I get to see someone else. Totally okay to do. These are just some tools that you can start using right now, whether you have bunions or you don't, whether you have pain or not. Ultimately, if you do have pain, please go see a physical therapist. If you're just scrolling YouTube or listening to the podcast in hope of we are going to be the fix, we're just going to provide some tools and education, but we are not the fix of anything. So hopefully, unless you are seeing us in person, so hopefully you're working with someone that is going to help you provide that treatment that you need for yourself.
Yeah. So one of the first things that, we talked about finding that passive mobility.
Yes.
And this is something that's super easy, something that I've been doing a whole lot more since, I met Jen a couple of years ago, and it's toe spacers. Whether you have a toe spacer or have bought a toe spacer, or do your nails a lot so you have them laying around, or just take a sock. So if you have a sock and you just take it and weave it between all your toes, just tell me if I'm teaching this wrong, babe.
Yeah, it's something that I do I get so many DMs and messages of people who are showing me their feet, and I absolutely love it.
We got a weird thing about feet that's just part of our job. Then there you go. You got those toes all spread out, those socks.
And all we're doing when we do this, and the reason that we talk about it, is because we have these deep muscles in our feet called our intrinsic foot muscles. And we are kind of standing on them, walking on them, using them all the time without giving them a break, unless we're trying to get like a deep tissue into our foot or something. And one of the best ways to think of stretching the feet is to literally separate the toes and have this separation, it passively stretches those intrinsic foot muscles, gives them a break, teaches the toes where they can go in a new direction and range of motion, so that ultimately when we get back to movement and active work for those toes, for the feet, and then for the whole body, they know where to go and they know how to activate. So getting this passive range before we get the active range is always key. Immediately after, we need to try and access that range. So trying to just spread your toes, right? Which at first might feel really weird when you start trying it, because we don't consciously think about spreading our toes like we can our fingers. But in reality, the musculature and the structures are fairly the same, so we can do all those movements. So giving good repetitions to that range that the socks may have helped you explore a little bit. And you want to try to get separation from all of the toes. And at first you're going to be, if you've never done this before, you're going to be looking at your toes and you're going to be like, nothing is happening.
They're not moving.
It is not registering. And that's okay. It takes time. This range just teaches the body, oh, I can spread. And then working on spreading those toes is such a good way to start to activate that intrinsic, those muscles on the inside of the foot. A lot of times we think about this midfoot and we think about just strengthening exercises. How can I pull the toes and pull like a towel from the toes? How can I grip the ground and cause this arch to be more stable? And how can I do exercises that really promote that arch? Well, one, working on the toes does help promote the arch. Two, also, we cannot forget about the balance of pronation. And whether you are flat-footed, high-arched, we all need to develop the functional capacity of obtaining pronation and supination. So pronation, think more flat foot. So pushing into that, don't be afraid of it. So we can stretch that midfoot. And then supination, think of a high arch, really contracting that foot. All right, so all I'm going to do, take 2 towels, roll them up so that it's off the floor. I have my heel on it. I have the ball of my foot on it. And I'm going to put weight into this foot here. Okay, now I want to go from the outside of my heel to the inside of my big toe. Okay, so it goes heel to big toe, and I start to bend my leg into it, and I actually can feel a stretch at the bottom of that foot. So this starts to open up that midfoot area. Okay, so this is what we talked about, getting both supination, pronation. Don't worry, this is not bad for your knee. It's going to fall on the inside of your toe because it's going toward the inside of your toe, but it's to stretch that very bottom of the foot. I'll just show it this way real quick. So we come here and we come in and out, and I feel a stretch literally at the bottom of that foot. So again, we're not loading. It's not going to be bad for the knee. It's going to be great for the foot. And again, if we can start to get both ranges of motion, we start to get into a better balance and activation in that foot naturally.
And then we work up a little more and we're in the ankle. And what the ankle does is it inverts and it everts, right? And kind of with pronation and supination, you know, when we supinate, we're going to be a little more inverted. When we pronate, we might be a little more everted at the ankle. So these are the yoga tune-up balls from Tune Up Fitness that we love to use because of their texture, because of how soft they are. So just place it under your big toe. And the first thing that you can do is start to kind of pump that ankle up and down. And as you see, it's just going to work it out into that extension, right? And one thing that you want to be aware is that your foot or ankle isn't rotating in any different way. We're just focusing on getting that big toe back into extension. Once we do it passively, a good thing to do is kind of contract down, because then we're actively activating and supporting those muscles in that extended position. You can also then go to the middle 3 toes and kind of pump up, do the same thing passively, and then activate at the end range. And also the pinky or the outside 2 toes, working those into that extension and then actively squeezing down in extension. So that's another thing to both passively and actively work that toe extension. Along with working in the midfoot, you may be just by proxy working on that inversion and eversion at the ankle a little bit. And then, maybe we get into standing and then we start doing some more dynamic stuff. That would be the next step, of course. But if we're kind of standing and learning to rotate over that foot through the midfoot and the hind foot, and if that's the intention of the exercise, that can be very powerful. And again, when we get put into situations out in the world, our feet feel more comfortable with that. Another thing with the tune-up ball or the therapy ball is to put it just in the bottom of the foot and roll around. So we're exploring those tissues in the bottom of the foot, that plantar fascia, a lot of those muscles, both intrinsic and extrinsic muscles of the foot, and just slowly going and finding, okay, there's a spot for me that's a little bit tight, a little bit angry, and kind of moving around and finding how you can change that pressure, change how things feel in there. So that's a good kind of passive way to work on those tissues on the bottom of the foot.
If I'm looking at the bottom of the foot, I have to play a role up the back chain of my body. So if you do have tight calves, if you do have tight Achilles, it's going to play a role on the bottom of your foot. And this is why I show ankle exercises and mobility work for the ankle, because it does play a role to the bottom of the foot. So if you know your ankles are restricted, it's probably something that you get to start working on as well, because that can definitely have an effect all the way to the bunion and the toe.
For sure.
Last one we kind of talked about was getting that foot used to, again, that range of motion going all the way up to the hip. So one way that you can do that is just, again, allowing that hip to kind of externally rotate, that opening in that hip with that foot falling down. And then we're going to rotate and internally rotate this hip. And then we're going to kind of squeeze at the bottom of the foot. So it falls and then it squeezes. And all my weight, all my pressure is on one hip, on one foot. And so I start to get that balance between that pronation and that supination, feeling what is happening at the bottom of the foot as it rotates and squeezes in the arch and then pronates. Again, feeling that all the way up into that hip, rotating. And then once you start doing more dynamic type exercises, you have that awareness from the feet all the way to the toes of what's happening all the way up the chain of the body.
One of the biggest things that for everything we've been talking about with the toes and the midfoot and the hindfoot, that's helped me functionally explore that is the change to barefoot shoes. Because for me, when I started, I had not used a barefoot shoe hardly ever. And so when I put those things on, when I went for a mile jog, my calves were just barking, my midfoot just felt angry at me. But now after using them for a year and a half, I can just tell that that extra space is something my foot appreciates, because now it's learning to kind of control and feel safe and in control during all those movements. Yeah.
I mean, the Vivo barefoot shoes have been game changer.
Yeah.
We have been using them for so long. I remember even having a client come in and she had like huge thick shoes on because she thought that's what she needed for her knees. And she looked at all our shoes that were where our shoes go. And she was like, oh, you guys really do like these.
Yeah. We don't just lie about it. We're not kidding. We use these things every day because of the principle that it's going to help us apply these things out in the real world. You know, if we put that shoe that has a ton of support on, maybe that's where our foot is at. But once we do those passive mobility things and active mobility things, then learning to load it and use it functionally is the next step.
Yeah.
So if we then bind our foot back up in this thing that gives us all the arch support, you know, my feet are very used to football cleats, baseball cleats, basketball shoes, which were all so tight with arch support in them. You know, that's where the influence on my feet has come from.
Yeah.
Right?
Yeah. Luckily, I was a gymnast, so I walked around barefoot everywhere.
Lucky.
Traveled places I shouldn't be barefoot, but I was. But, you know, and all of this to say, we might not change the structure of your bunion.
Yeah.
Your bunion might still look like, you know, your toe is going in and some things are happening. What we aim to fix, and I want you to remember this, is we want to change the function of how your foot is working, how it can be stretched and activated and work in all these different areas, how it responds to the rest of your body up the chain from the leg all the way up the body into your hips and into higher, and how it feels.
Yeah.
Is it still painful? Do you still have pain? Are you not functioning well in your life? We're not aiming to fix the structure of something. We're aiming to fix how it functions.
Hey, thanks everyone for joining our PT Pearl on bunions. Hopefully you learned something about how those toes are functioning and things that you can do to impact the way that feels. If you loved it, subscribe, comment below, let us know what you want to learn about so that we have more PT Pearls coming up for you.